Hello, Mrs. Carell. My name is Amy Williams. I'm a nurse practitioner student. I'm going to just check you out and see how you're doing today. What brings you in here today?
For the past few days, I've just had this really bad headache and kind of sinus pain, and I just can't seem to get rid of it. Just miserable.
When did this headache start?
It's been probably about 3 or 4 days, and it just feels like it's getting worse.
And you said it's, where exactly is the headache located?
It's kind of like across the front of my head, and I feel it under my eyes.
Okay. And is it like, how would you describe the pain? Is it like a constant? Does the pain come and go?
It's like a constant pressure kind of a pain.
Okay.
Heaviness.
Is there anything that seems to help relieve the pain?
I've tried Tylenol, I've tried Advil, and it kind of dulls it a little bit, but I still just have all this pressure that I can't get rid of.
Is there anything that it seems to make it worse? What
position? If I lay down, I feel like it's a lot worse.
Okay.
The pressure's in my head more when I'm sleeping or laying down.
Is there anything you've been taking? You said
I just tried the Tylenol and Aleve, and that just not doing it.
It's still not cutting it.
No.
Still not relieving that pain. Okay. Well, I'll definitely take a look at you. Let me first by asking, do you have any prior medical history?
I have hypothyroidism. I have
Okay.
Hashimoto's, but that's pretty much it.
Okay.
And menopause. If that's a diagnosis.
What about prior hospitalizations?
No, just with my children.
Okay. Prior surgeries?
I have had back surgery. I have clips on my T3.
Okay. What about your immunizations? Vaccines, are they all up to date?
Yes.
Okay. Had all your childhood vaccines and that?
Correct.
Okay. Let me go ahead and ask you about your family history, prior history, your parents. Do you know, does your mom, dad, do they have any cardiac history of cancer, anything like that?
My mom had brain cancer. She had glioblastoma.
Okay.
Before that, she did have high cholesterol.
Okay.
My dad does have high cholesterol and high blood pressure.
Okay.
Other than that, no other cardiac or anything like that.
Now, do you know the history of your grandparents, your prior?
I do. My maternal grandmother died of breast cancer in her early 40s, and my maternal grandfather had a heart attack at 65.
Okay. What about your paternal grandparents?
My grandmother, she died of stomach cancer, and my paternal grandfather, he died of CHF, but he was 92 at the time.
92. Okay, and how about, do you drink any alcohol?
Once in a while.
Okay. Oh, and I'm sorry, I was going to ask you about your siblings. Do they have any prior medical history, your siblings?
I have 2 sisters and a brother. My one sister, she has high blood pressure. She takes medication for it. My other sister has leukemia. She has non-Hodgkin's, but she takes chemo meds every day. And then my brother, I really don't know. I don't really have contact with him.
Okay. And you said, I'm sorry, how much do you drink a day?
Oh, I drink maybe once or twice a month.
Okay.
You know, a glass or 2 of wine.
And what about smoking? Do you smoke at all?
No.
Do you have any illicit drug history?
Nope.
Okay. Are you married?
Yes.
Okay. Do you exercise?
I do when I'm in the mood. I try to do it 3 times a week. I try to at least do some sort of weight-bearing exercise. Other than that, we just try to walk in the neighborhood where we live.
Okay. And in terms of your diet, do you know what you ate yesterday?
Good question. I try to really eat a lot of protein for myself just to keep my muscle mass. So I try to do protein shakes for breakfast. Try to do something lean at lunch, whether it's chicken or a salad or something like that. Dinner, I'm not always perfect, but try to stick with more of a protein base and vegetables if possible.
Okay.
We eat out often though. Kids aren't at home.
Okay. And are you currently working?
I am. I work in the school district. I'm a nurse.
Oh, okay. And what about education? What was your last, do you have your bachelor's?
I have my bachelor's, and right now I'm trying to obtain my master's degree in family nurse practitioner.
Oh, okay. Do you have any allergies?
I do. I have a pine nut allergy, or pinuli nuts.
Okay, and what symptoms have you had from that?
I have an anaphylactic reaction to them.
Okay,
So
do you carry an EpiPen on
I
you?
do.
Okay. And do you have any drug allergies?
Not that I know of.
No drug allergies. And no other, what about environmental allergies?
Not that I know of, no.
So just that food allergy is
Yes.
the only one you know of? Okay. Are you on any medications?
I take thyroid medication, but it's a compounded medication. It's a T3, T4. I don't know the exact dosage offhand, to be honest.
Okay.
And I also take progesterone and DHEA for my
Okay.
menopausal symptoms.
Okay. And that's all you take?
Then I take a multivitamin. I take fish oils, red yeast rice, CoQ10.
Okay. And you take those daily?
Yes.
Okay. And in terms of your, do you have any problems with your skin?
No, not for the most part.
You-
It's been drier as I've gotten older, obviously, and with my thyroid, sometimes it's drier than I'd like it to be, but overall, no.
Okay, and your head, you don't have any lumps, nothing like that on your head?
No.
What about your eyes? Do they seem more watery? Do you have a lot of drainage or anything from your eyes?
No, but dry eyes sometimes also, again, from my thyroid.
Okay.
So,
And what about your nose?
no issues.
No drainage coming out of your nose? No pain? Nothing like that?
No, just right now, just the pain in my nose, but not normally, no.
Okay. Your mouth, your throat, do you notice any sores, any lesions, any lumps?
No.
Okay. Your neck, you don't feel like you have any lumps there?
No, my thyroid gets checked yearly.
Okay. In terms of your lungs, do you ever feel like it's hard to breathe? Do you ever feel like you get short of breath?
No, not really.
You don't have any history of asthma or anything like that?
No.
Okay. In cardiac, do you don't have any history of high blood pressure? You've never felt like your heart is palpitating or anything like that?
No history of blood pressure, but sometimes heart palpitations, and again, that's due to my medication. If it happens, they have to lower my thyroid meds. So that is a sign and symptom of if it's too high, I know.
Okay. And in terms of your abdomen, have you had any pain, any nausea, vomiting, diarrhea, anything like that?
No.
Okay. Now, in terms of have you had, you said you have gone through menopause?
Correct. It's been 3 years.
Okay, 3 years. And you're on medication, does that seem to be helping?
Oh yeah, it helps my night sweats tremendously.
Okay. Any other neuro issues, like you feel like you have any confusion, memory problems, anything like that?
No, sometimes some brain fog, but I just think it's getting older.
And in terms of your blood sugars have all seemed fine whenever they've checked your blood glucose levels and all that?
Yeah, my A1C is fine.
Okay. Have you ever had any bleeding problems?
No.
No bleeding problems. Okay. Well, Okay, Mrs. Corral, I'm gonna go ahead and just do a physical assessment here. I'm gonna start with your head. I'm gonna go ahead and palpate and look, just make sure your head looks symmetrical. I'm gonna palpate for any bumps. Just look around for any lesions. Does any of that hurt?
No.
All right, what about here?
Just a little bit of pressure on my
Pressure
head.
here?
Yeah.
Okay. I'm gonna continue down. I'm gonna go ahead and palpate your sinuses right here. And I'm also going to, this is called percuss. I'm also gonna percuss your sinuses. I'm going to palpate your temporal artery and continue down palpating your lymph nodes. Okay, everything looks good. It's just a little bit swollen there around your sinuses. I'm gonna go ahead and take a look at your eyes. But before I do that, I'm gonna actually have could you look up for me? I'm just looking at your white part of your eyes. I'm looking at the pink part of your eyes. Look down, please, now. Okay. All right, and now I'm just gonna go ahead. Could you squeeze your eyes tight for me? Just checking all your nerves in your body. Could you puff up your cheeks for me? Okay. Could you smile? Show me your teeth. Okay. Now I'm going to have you close your eyes, and when you close your eyes, could you tell me if it's sharp or dull?
Sharp.
Okay.
Sharp. 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 Sharp.
Okay.
Dull.
Okay.
Dull. 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 Dull.
Okay. Now I'm going to go ahead and take a look at your eyes. Before I do that, I'm going to go ahead and have you open and close your mouth. I wanted to check your T and J. This is your joint here in your jaw. I don't feel any clicking in that. Okay, so let's go ahead and look at your eyes. Could you look straight ahead for me? First, I'm going to start by just looking at your pupils right now. And now I'm going to go ahead and look in your eyes, just get a closer view here. The red reflex. You continue to look straight ahead for me. Okay. Now I'm going to test your acuity. Do you wear any corrective lenses, contacts at home?
I do wear glasses for distance, usually at nighttime though.
Okay, okay. Can I have you start by covering your right eye, please? And if you could read this last line for me.
LTFPH.
Second line.
GFDHJ.
Okay. Next line.
EPTZO or D.
Okay. Next, this line up, I'm sorry.
DHJBS.
Okay, go ahead and can you cover your left eye for me? And let's start with this last line here. Oh, I'm sorry, if you need a
No,
minute.
it's okay. LTFPH.
All right, next line up.
GFDHJ.
Next line.
EPTZO.
And the next line up.
DHJBS.
Okay, and so what it means by, it looks like you have 20/40 vision, and what 20/40 vision means is that what you see at the 20 feet, a normal person would see at 40 feet. So that's what that means. And I'm going to have you go ahead and take a look in your nose. And you said you did have a little bit of congestion in your nose?
Mm-hmm.
Okay. All right, and I'm gonna look in your ears first, but before I look in your ears, I just wanted to go ahead and take a look. Your ears look symmetrical, everything looks good. I don't see any bumps or anything on the outside of your ears. Okay, so now I'm just gonna look inside your ears here. Okay, now I'm going to take a look in your other ear. All right, everything looks good from what I can see. And now I'm going to go ahead and take a look in your throat. All right, if you could go ahead and say ah for me. All right, your tonsils look good. No lumps, no, okay. You have a good gag reflex. Okay. Now I'm just gonna test, I'm sorry, I forgot with your eyes to test your other cranial nerve. If you can just follow this pen light with your eyes, don't move your head, okay? Up, down. Okay, looks good. And now I'm going to go ahead and have you, I just want to test your shoulders. If you could, I'm going to push down your shoulders. If you can lift your shoulders up, push against me. Okay. And now with your neck, this is testing your neck muscles. Push against this hand and then push against this hand. Okay. And I'm just testing, I'm going to check on your trachea. Make sure your trachea is midline, everything is lined. If you can go ahead, I need you to swallow. I'm testing your thyroid gland. Okay, now I'm gonna palpate your carotid artery. Okay, that feels good. And with palpating, I'm also gonna listen to that artery. Okay. Could you also tell me your address?
3972 Trailwood Court, Valdosta, Georgia.
Okay. Well, thank you. This concludes the physical assessment portion. Did you have any questions?
No, not at the moment.
Okay. It looks like you might have a sinus infection.
Okay.
It did feel a little swollen around there. You're having some pain. You have a headache. So we're gonna probably put you on an antibiotic. I'm also gonna go ahead and swab you for flu, for strep, and for COVID to see if you could possibly have any of those either.
Okay.
I'll probably just have you also take something as needed for pain. Probably I would go ahead and take Advil or ibuprofen for pain as needed. Any other questions?
No.
All right, thank you. It was nice to meet you. Have
Thank
a good
you very
day.
much.